Drug abuse. Cancer.
Measles. Diabetes. AIDS. Cancer.
Drug abuse. Cancer.
Measles. Diabetes. AIDS. Cancer.
Drug abuse.
Distributed by Echo Blue Limited. Visit us on the Lansopine Main Road or call 405-4818.
Asian Spa and Wellness Cafe, nestled in the serene surroundings of Le Phare Bleu, Calivini Bay, St. George, is the perfect spot to unwind and relax after a stressful event or when you wish to spoil yourself in the most comfortable and relaxing atmosphere. They offer many different massage modalities, including thigh hammer, washer and cupping, signature thigh deep tissue massage, also facials to depuff and tighten pores, deep cleanse full body, hair and nail treatments and more. Take a walk down to the cafe for authentic Thai breakfasts and delicious traditional dishes. Choose from our special mixed drinks, both hot and cold. Opens daily. Visit Asian Spa and Wellness Cafe today, Le Phare Bleu, Calivini Bay, St. George, because you will not regret you did. Are you longing to taste authentic, flavorful dishes from Thailand? Then look no further. Konthai, the newest restaurant located at the back of Galleria Mall top floor, is the place to satisfy your taste buds for Thai dishes that are well seasoned with fresh local spices. They offer a great selection of sumptuous dishes that will tantalize your taste buds. Visit Konthai today because the food is good, the ambiance is great, and the staff friendly. Available on Carabites and Yogo Grenada. For more information, call 456-0074 or visit konthaigrenada.com or stop by the new Galleria Mall, Grand Anne, St. George. I'll meet you there.
At Oasis Pet.
Drug abuse. Cancer.
Good evening once again and welcome to another Doctor on Call. It is a pleasure as always to be with you. Of course, it's Tuesday evening and we welcome all our viewers on GBN Television 7 and 11, our friends on our Facebook page, that's GBN Live, our YouTube channel and on K105 FM. Well, the month of October is Breast Cancer Awareness Month and this evening we will be talking breast cancer, women's health, but of course with heavy emphasis on breast cancer. The theme for this year, some of the activities planned for this month as it relates to breast cancer awareness and more. Of course, we will be engaging you, taking your calls or your questions via our Facebook page, telephone, and also on the WhatsApp platform. So good evening once again, welcome, and of course, as always, Dr. Nixon with us. Doc, good evening and welcome. How are you?
Good evening. It's hot, but I'm all right. Thank you. Good evening, Grenada, and our friends in the diaspora and beyond. It's nice to have everyone on this very warm Tuesday evening. It's probably going to rain in the night, but
yes,
nice being.
Yeah, we may get a little something, but it's always good to be here and to have those discussions and to share information with our listeners and viewers. Doc, October 1st to the 31st, Cancer Awareness Month, or Breast Cancer Awareness Month. The theme for this year, every story is unique, every journey matters. Let's talk breast cancer.
You know, probably 20 years ago, you would not tell me that. Let's talk breast cancer. Because we just never talked about the big CA.
Yes, that's true.
Especially women's breast. You know, it's been such a, unfortunately, privately held topic. Nobody wants to talk about their breast since it's so intimate. We still have challenges with women examining their breasts because of what breasts have become related to. But I guess everybody takes example from the US and how the US has been able to make breast cancer become a thing to reckon with women. Not to be reckoned with, that it is going to have to reckon with women, because women recognize it as such a big killer. And why did it kill us? Because we didn't look for it and eliminate it. We didn't do the things that can prevent us having the breast cancer. We didn't go and get screened early. We didn't have facilities in the U.S. where, especially women of color and women who didn't have health insurance, didn't have access to just primary care and screening facilities and being able to diagnose early. Many women turned up when they had fully developed and often spread already metastasized tumors, right? Which only led very quickly to the demise. Today, women are very aware. Women are don't have a problem in having to remove their breast completely if their tumors have grown, significantly and have a greater chance of spreading elsewhere. So it's something I said breast cancer is going to have to reckon with us, because we are out there looking out for it and trying to deal with it. We still have to take some precautions to do the things that will prevent us from getting, and we're going to talk about it. But generally, we talk about it. I was talking to somebody who works at a group of women survivors. And we have women who have survived cancer for 35 years and 40 years, simply because they went looking for it early or they identified it early. So she was saying, that more and more women are looking, and there's less death as a result, because women are now aware that is something I got to look out for. Once I'm a female, I run the chance of very high risk, along with other risk factors that can make you more prone to developing breast cancer. Women are out there looking for it and making sure that if it's there, because they can't stop it before it appears, they will stop it when they catch it. And the earlier they catch it, they know the longer. So if a breast cancer is diagnosed stage 1 and stage 2, that's where it's just there, or it's put a little bit in the breast tissue, not far away, your chances of living are up to, like, for 5 years, 90% for stage 1, right? And we go every 5 years. If you live this first 5 years, you live the second 5 years, what are the chances of survival? So I think if women don't take away anything tonight, or the people who are here, both men and women, if they don't take away anything tonight, I want them to know that we can go out and hunt breast cancer if we're at risk,
right, and
discover it early, right? We have a little more than we did 20 years ago. Well, significantly more access to health care. In Grenada, going to the health center is still free. So if you need to go and get screened. But we still have to share the message among our women. We have to tell one another and talk to each other instead of talking about what's on TikTok and who wear what frock and who whatever it is, who David who and all the foolishness. I think it's a good time to have edifying conversations among ourselves in the workplace, among ourselves in the church, among ourselves, the women that you meet on the street. You create the conversations. So we have to make sure that we encourage women to become comfortable with recognizing this, because this is the number one care of cancer death among women in Grenada still. And we have to work towards, even if it remains at number one because it's there, we have to make sure that number one is a less and less number every year when it comes to death.
Okay, so Doc, I mentioned earlier the theme for this year, and that's from the World Health Organization. And the question is asked, why this theme? And I just want to share a little bit with you before we continue the conversation. So the reason, every breast cancer diagnosis is personal. Behind every diagnosis is a story of courage, resilience, and hope. This theme reminds us that breast cancer touches the lives of women and their families around the world differently, and that every journey deserves compassion, dignity, and support. This year's theme recognizes the diversity of experiences and reinforces the need for compassionate, timely, and quality care for all, regardless of geography, income, or background. I think in there, there is so much to talk about. We can take some of these individually and discuss it.
So I think the most significant thing is that everybody's journey is theirs. Everybody's experience is theirs. Mm-hmm. But what makes us all similar as women with breast cancer is that every one of us has a journey. And in sharing the experiences and supporting another woman's experience, I guess everybody's life is enriched, right? You always have support groups, and you say, well, I'm an alcoholic. For example, right? I'm an alcoholic. So what are your triggers? Well, my triggers are when I come home and my wife starts quarreling, all right? My trigger is when I go to work in the day and I don't feel that or I finish, it's the end of the month and I don't think my salary is going to, that triggers me off. But that's my experience. Another person's experience might be totally different. But the bottom line is that we all have some experience. Bottom line is there's certain things that we all face together that are similar. And in sharing our experiences, we can strengthen our resilience as a group. Okay, we can give hope to each other, because that is what women are giving to each other that are diagnosed. Think about it. You've seen women who are out there who have had both their breasts removed and who don't have a problem walking without a shirt. We've come a very long way, and it happens even here in Grenada, right? Where they recognize this is not good. Let me get rid of it. It doesn't change the character of who I am, right? But often we need support, we need strength from outside, we need acceptance, we need respect. We need people who propel us into moving on from what our sad experiences, because I'm sure, as strong as anybody is, getting a diagnosis of breast cancer because of what we've known can happen is something that that can be feared, right? But once we can coalesce, we can come together and look and support each other, it makes the journey easier for every new person. Because here you have women who have walked the road, who know what I'm talking about because they've walked the road, right? And women who are willing to continue walking the road, but they're not leaving the person who behind. He who just comes on the journey is not left alone. The importance of having an early diagnosis in a disease, any disease whatsoever, is to be able to reinstate your life to as normal as possible. We do not want that a woman reach to a stage where you're mutilated. You're so bad, the surgery has been so bad and so long, and you have chemotherapy and you have radiotherapy and you have all the therapies. That can take a great part of your just a normal everyday existence, that you can be very tired, that you can not produce. We don't want our 27-year-olds who develop breast cancer to lose a sense of hope that they will surely die. We don't want the mother who has 4 children in high school to feel that, well, this is end of it. What's going to happen to my children and have to go through? That support must be there. And we have to continue to encourage our women to go out there and look. So those who have survived can say, hey, look for this. And those who have survived can welcome those who have had a diagnosis and say, look at me, I've been here for 20 years, don't worry. We'll help you get through this, right? that is what makes it a lot easier for women, knowing that I'm not alone. This is not something I have to hide. There are other women who have the same problem. There's enough compassion and love and understanding for us to come together and support each other. Are we all going to survive? Maybe not, right? Maybe not until we have more advanced methods of technology, more access to the technology, more access to surgical, whatever, all the fancy things that are coming up as means of therapy, right? Women are afraid to do mammograms because mammograms are painful. But I can tell you, my friends in Montego Bay tell you that their mammogram is a thing where you can just put a breast in a space, lie on the tummy, and take the thing. I wish we can do that. Maybe we can have services in the Caribbean, in the Eastern Caribbean, where women here can access that form of having a mammogram done, okay? Or an MRI of your breast. So what our experiences serve is to empower whoever is behind. Or even the group. There's some women who have it harder. They're older, they may not have an income, they may have to buy medications, whatever it is. That everybody together is very, very important, despite your personal experience.
Now, in 2021, the WHO, the Global Breast Cancer Initiative, together with partners, started working with countries to reduce breast cancer mortality by strengthening health systems. So they approach the 60-60-80 targets. Could we speak a little bit about that and like share some information, Doc?
I can't give you all the data on that, okay? I just know that any system, in order for this is a public health approach, okay? And public health looks at big groups. And so I can look at my breast cancer. I don't have breast cancer, but I can look at my breast cancer and say, I can afford to do my mammogram, so let me do my mammogram. If I find it, I can probably go to my friends in another country who do my surgery, get my chemotherapy, blah. That's my experience, right? What they want is that people are diagnosed a whole lot earlier, right? That a larger percentage of women survive, right? And a large percent of women have treatment. Okay? So we're gonna diagnose, we're gonna make sure they treat and we make sure that women survive. That's how the 60-60-80. At least 60% of women are diagnosed early. 80% of those women are going to have access to therapy, and the rest are going to live. Another 80% of those who we have treated are going to have extended lifetime. But it means you have, like they say, they have to create the favorable conditions within the health systems, which are education, first of all, so women know that they're at risk. Women know exactly which one of us is at risk, and even if I'm not at risk, I'm going to get checked, and I'm going to check early and annually, where according to what the system is, what system? Because some people don't check every year. Okay, they're different schools of thought. Okay, but at least every 3 years you should have a mammogram for the women who already have reached age 40, right? Are we there yet? No, we're not. You know why we're not there? Because there's only one mammogram machine in Grenada, and there are 50,000 of us. Okay? But 20 years ago, there may not have been a mammogram machine. So that's improving. What we have facilitated is training our nurses and the doctors everybody should do a clinical breast exam because you're a clinician, right? Where you examine women's breasts and at the same time you teach them how to do self-breast examination and create that awareness that if you keep looking, if it's there, you will see it. If you understand what your baseline is like, if it's there, you will see it. If I examine my patient every year, or encourage her to examine a patient every month, 2 months, 3 months, right, to examine herself, she will come and say, hey, I find something in my breast that wasn't here the last time I came to you. Can you look at this? And then we have other technology, which is like ultrasound, because while you have to train, the technician must have special training to be able to examine an ultrasound. It's less invasive, it's not tender, It's not painful. It's not scary. It's and it's easier. Okay, and you can actually screen any group, any age group, because we generally don't do mammograms on women under 40 because the breast tissue is still dense, and we don't want to create any damage to the breast tissue because you have to press it between the two plates. But so, how much education is there? Is it ongoing? Where do women seek education from? So out of Breast Cancer Awareness Month, October, do women really go and find online, let me think about my breast. Do they go on? There currently is, through the Cancer Society and with WINDREF and PAHO, there is a site called the Caribbean Cancer Portal, where women and men can go on. Anybody can go on and look for information on cancer. Okay, the Caribbean Cancer Portal, right? You go on there and they give you a lot of information, how to screen, what your risks are, or what are the risk factors associated with. And there must be information for everybody. So if you don't have an internet, there must be a place where you can get information. The health center should have, pamphlets and other things. For the women who can't read and stuff, there must be a means of generating information so everybody, there's equity in knowledge, okay? Whether it's access or whether it's just having information, everybody must be able to access knowledge, all right? And as clinicians, as caregivers to patients, we have a responsibility, not only in October in Pink Month, we have a responsibility to tell women, to inform our patients, especially when you see a patient for the first time. Have you had your breast examined? Okay? What do you know about this? And teach them. I teach all my female patients to examine their breasts. Right? I'd like to, for the most part, ask them to show me how you do it. Right? Or some women become bold enough because they're so comfortable. So tell me if I'm doing it right. It takes you extra 5 minutes. Okay? And you say, go home and do it. If you feel it wrong, just come back one day. Let me show you again. Okay? That kind of open door. We have to take it on because that is what keeps our patients from dying, from a premature death.
Right.
Okay? That is what. People being aware and of course, handing them the responsibility of their well-being. And they must be the ones who make themselves live longer because they want to live longer. Right? And I think I should touch here on the risk factors.
Right. So
what are the things?
Okay, just before you go there, let me just put it to you as a physician. So someone comes to you.
Me, right?
Yeah, you.
Yeah.
You're the only physician here.
We probably don't. I don't want to talk for nobody else, but you know how it goes. Right. That we all have to reach. So.
Right. So a female comes to you, and she says, "Look, I feel something a little uncomfortable in my breast. Can you check it, or let's together check it and see if everything is fine." And of course, together with the patient, you all do an examination, and as a physician, you do feel something that even without the screening, maybe you have in the back of your mind an inclination that it could be something.
Right, index of suspicion.
Right. Now, we all aware that once human beings hear the word cancer, we know what happens. Everybody gets scared. How would your conversation go forward from there?
So the other things that I will ask first, which are those risk factors. So the fact that you're a woman increases your risk of having breast cancer. So like almost any woman, by the fact that she has a pair of developed breasts or just breasts, develop beyond flat chest, beyond our girls, right? I talk about a 5-year-old, right? Once you have breast tissue, you're on the risk. If you smoke or drink, especially young women who smoke, you already have increased your risk. From just being a girl, if you drink alcohol, and I'm talking to our young Grenadian women, right? Because I've seen people 27 and 28. And the studies show that these women, and the study in the UK showed that these young women who drink, and we like to drink rivers and under the counter. And I'm serious, strong alcohol.
Yeah.
The more alcohol you consume, I saw an article there, I didn't get a chance to read it, about the risk of the correlation between alcohol consumption. It was a British study, again, alcohol consumption and the increased incidence of breast cancer in women. So research over and over, and we're scientific research based, okay? Understanding that if you live a certain lifestyle, women who are overweight have a greater risk. Women who have a family history, and it has to be like your mother and her sister them, your father, sister them, and like maybe your cousins, just that first generation and relative. If you have had breast cancer before, you still run the risk of having it again, because your other breast might be just there sitting down waiting for the foolishness to happen again.
Right.
If, like I said, if you're overweight, if you have been on hormone therapy, there claims to be greater risk. If you're exposed to certain carcinogens, toxins in the environment, because we found that the women in Boston were found to have increased risk of cancer in general, and of course breast cancer, when they worked in the industries that use chemicals for cleaning, whether it was washing, like housekeeper, hotel keep, and housekeeping, laundry, and housekeeping, where they use a whole lot of chemicals, and they inhale these chemicals and stuff. So they are found to have an increased risk for cancer. There are a couple other things that I don't remember. But those are the fundamental ones, okay? Oh, if you have not had children, if you've never been pregnant, and if you had a period that started much earlier, if your period started early, very early, or it finished very late, and if you've never breastfed. So even if you had kids and you haven't breastfed, breastfeeding seems to be a factor that controls the potential for having, and I guess it's the hormonal influences that occur on the breast that decreases the risk of having breast cancer. So those are some of the risk factors. So I'll ask all these questions, right? And then you examine and you say to them, look, let's look and see what's here, right? And if I find a lump with my patient, sometimes the patient, I describe what it should feel like if it were malignant, because it does feel a little different. Right? And I guess after a while, after you get accustomed to doing this, it becomes kind of second nature, right? But I'd say, let's look at what you see. And which breast, I'll examine that breast second, and go through and see what it is. Because a lot of women find lumps, and they don't understand. Because breast is lumpy tissue, breast is glandular tissue, glands. You have lumps of tissue that come together, right, to produce milk. You have fibrous tissue after you get to a certain age, and it's little clumps, and they get scared. Sometimes it's very obvious. There are indications, there are signs that are very obvious. It makes the breast looks bigger than the other. It's asymmetrical. It's pulled up. You see the skin changes. You might have a sore in a very late wound. So I think the first thing is to tell you, let's find out what's going on. This is not a death sentence. Let us figure it out. The earlier we do this, the better. Okay? The earlier we do this, the better. You might have to do some tests. You might have to go, get an ultrasound or a mammogram done to determine this. And if there's a lump there that is suspicious, you'll have to go to the surgeon who will do a biopsy. And a biopsy is really getting in there, guided by an ultrasound. That's the safest way to go to exactly where that abnormal tissue may be lying. And you take a little sample, you use a needle. It's a special, right? And you take a needle. We do a needle biopsy, and that is put under the microscope. And the specialist, the cytologist, right, looks at it and determines whether there's cancer or not. But that's why it's important, because I've seen patients who have had more than one biopsies, but they didn't use ultrasound. So they find all the inflamed tissue around this lump, right? When you use an ultrasound, it tells you exactly where the thing is, and you can the needle getting in there, and you get the specimen that you require to ensure that you can give the patient. And of course, we would expect that the cytologist, the specialist, the cell specialist, is sufficiently knowledgeable to recognize the changes that are related to having a cancer.
Okay, lovely.
From there, you still have to give a patient a little thing and tell them, look, let's work this together. Because the patient needs you. I have open door policy, so my patients can call me if they have anything. And I usually send them and call and set up appointments, where they need to go and do that. So they don't feel like they're walking alone. That's how I do it.
Right.
It's always better if a person feels that they might be at risk for having something like that they walk with a relative, because you need a little support. I cannot tell you, yes, I can tell you this looks a little suspicious, but let's go and do, because unless you have a biopsy, you can't give a diagnosis of a cancer. All right? So you have to have that little piece of tissue that you put on and you look on the cell on the microscope, and you see the differences in the cells, the changes in the cells that indicate that you have some malignant tissue.
Right. So next question. You did mention one of the questions you would ask is about family history. Now, is it specific? Because we have different types of cancers. So if, for example, someone's family history has to do with, let's say, cervical cancer, right? Down the line, the family tree down the line, are they at risk to just that specific cancer or any kind of cancer?
No, because I think it's mostly related to uterus and breast, right? And that's because it's so hormonally determined, right? So if you have uterine, you can have breast, and if it's there, you kind of look out for either of them.
Right.
Right? However, you can have no family history. Or you could have family history and don't have no cancer. So you could have no family history at all and get breast cancer. Right?
Yes, right.
You can have no family history and get breast cancer. Because remember, also, you can have a predisposition to having cancer because you may have the gene. It doesn't mean that you're going to get it if those other factors are not acting upon the tissue to ensure. So because your aunt, your mother, older sister, your auntie, 2 daughters, your next uncle, your mother, brother, 2 children, right? All of them have breast cancer. Doesn't mean that you have it, even if you have the gene, right? You may not develop it, but there's always a likelihood if the appropriate conditions and appropriate factors are placed on your being. Okay? And one of the other things we need to look at is stress, because our inability to manage stress does diminish our immune system. Okay? And you need your immune system to ward off all these strange things that happen, because for most of us, the immune system takes care of it. But if your immune system cannot work with it, especially if you're stressed out, you are likely to develop your cancer.
Right. Okay. Lovely. So, going back to the original question about the conversation and so with the suspicion. So I guess the next step is to have the patient been screened and all of that. How is share with us the process. How do you deal with the patient? Because one would guess from the time the patient probably understands that risk is there and there's a possibility. What happens going forward? How was the conversation with you and that patient? Of course, from your end, trying to make the patient feel as comfortable as possible, knowing that cancer is not necessarily a death sentence in this day and age, but it's something that you can deal with. Take us through the conversation.
You kind of remind the patient that you don't have cancer. I'm not going to tell you have cancer unless it's diagnosed, right?
Right.
You're probably at risk, but so what we need to do is, as quickly as possible, try and figure out what's going on with this lump, this situation in your breast, right? And I remind patients that earlier stage, earlier diagnosis, longer the possibility of living, less intervention, less, because if you have a stage 1, so in the US, for example, they just take out the lump.
Right.
Right? In some of the places, they take off the whole breast and they might do a reconstruction immediately. In some places, they take off the breast and they can't do a reconstruction, or they just don't have that kind of service. They just don't offer that as an option to do a reconstruction. So the woman comes back with what looks like a breast, and her chest looks symmetrical. Mm-hmm. But that depends on the jurisdiction in which you are. One of the things I ask my patients to ask me questions, and I don't care. Any question to me is valid, because sometimes some questions, people think they're stupid questions. Trust me, the stupider the question, the less I think you know, and it gives me an opportunity to enlighten you and to put you on the right track. So I ask my patients to ask me questions. What you want to tell me? Ask me anything, right? And people always ask if I think you're going to die. You think I'm going to die? I said, well, I'm going to die. It might be from this, but we're all going to die. Right. But I want to make sure that my duty towards you currently is to make sure that you don't die from this. And that is why I want us to go as far as possible and figure out where the source of support is. Sometimes you need to. I tell patients, come with somebody. If you're going to the doctor and you fear that is what it is, go with somebody. Have a hand to hold, and we also have to put ourselves out to be somebody's hand, right? That they can hold and make it a little less difficult. But like I tell you, one of the things I do is try and get my patients appointments, because nobody remember what to tell them. I remember somebody having COVID, and we were just talking about it during COVID, right? Mm-hmm. Very educated woman, right? Very independent thinking otherwise, very independent otherwise. And she says, when they told her she had COVID, and she was walking COVID, she can work, she had like a fever and like a tiredness and stuff. But once they told her she had COVID, she don't remember what else they tell her. They told her just go and take Panadol, and she just didn't remember that. Take Panadol, isolate yourself from your family because nobody else in the family had it and stuff. The point is, you forget, you don't hear. One of the things I do is write down. I have these little slips of paper where I write orders for patients, things, what is going on, what I think. So that when they go home, they can sit and write it and read it again, and where they're going to go and who's the doctor and what's his number, how you get there. So you kind of have a little chart of how we're going forward on this. The truth is, there's not much I can do except offer moral support to the patient once I'm sending my patient to get diagnosed. And somebody who has a lump has to have a mammogram or an ultrasound to determine that there actually is a lump. And then depends on the level of suspicion from the radiology, you get a biopsy. But that's done by the surgeon. And then the surgeon goes from there, because I would support my patients when they're getting chemo, but I don't determine what you get, when you get it. It's important to me, if you get it, that you get it, if you need it, right? So I would support my patients and call, hey, how are you doing? What's going on? Where are you now? That kind of stuff. Right. Mm-hmm. It's important. And it's probably a little hand-holding, a little extra hand-holding, and people say, oh, I'm not taking all that responsibility. I'm not going to see a lot of patients who have breast cancer. So this one person, and I guess as a female physician, it kind of gives you a little extra demand, places a little extra demand on you for compassion and understanding. And there among the female physicians who have had breast cancer, who understand the mental suffering, right? And above all, people become very scared of the unknown. And I wish we had a survivor tonight, because that fear of the unknown can be very difficult, right? All patients can see is the most negative stuff. Unfortunately, we don't have a lot of services, a lot of psychological services, and we should, for people going into surgery, because you might go to surgery, right? And the doctor is going to take a lump, and we look, you realize, no, I got to take this whole breast. You need somebody who would have prepared you. Say, wake up and your breast is gone. What happens when your breast is gone? your breast represents a very important part of your female sexuality. Okay. Right? Nobody wants somebody who missing a titty. That's the bottom line. That's what we think. That's what we think, that we're different. We have less value to the opposite sex, right? And even our female counterparts are going to think of us as being different because you don't have that great sex appeal because one of your breasts is gone. But we have to get over this, and I think it's also important to, that's why it's really important as well to educate our men on this issue, because they are going to be affected, whether it's a boyfriend, a husband, you understand, a father, a son, whoever it is, right, and not quite understand. Right? So while a husband might not want a wife who misses a breast, he also needs to understand first how a wife feels not having a breast.
Right.
Right? So one of the things I think we need to improve our psychological support services, and some people get therapy when they go into the hospital, but we need to improve our psychological support services, not just for the victim, the person who has the disease, but for their family as well, because there is going to be a change in their lives. If you have stage 3 breast cancer, where you have lymph nodes removed and stuff, you can't wash, you can do heavy stuff, you're out of commission for a little while, you have to go to physiotherapy, you probably can't go to work, and all the rest of it. So
right, wonderful. Now, one of the so as it relates to cancer awareness, and so Cancer Awareness Month, one of the calls is to get involved. Right?
Get involved.
Yeah. How can people get involved? Let's say, for example, people who don't probably have cancer, and people who have cancer. What are some of the things that can be done, to be involved in this whole campaign?
So I think the first thing we all have to do, it don't matter gender, okay, is to go online, your phone, read up what is this breast cancer thing. There are 2 major support groups. St. Andrew Development Organization has a support group, a survivor group that they offer support to, and Pink Ribbon down here in St. George's. And I'm not sure what happens in Guelph. I know there's usually a walk that Mr. Hostin organizes.
Yes, that happened some time ago. Mm-hmm.
Right? There are walks, and often at the walks, there's information that is shared. So I think everybody can learn. Everybody can learn what is this about. And in learning what it is about, then you can determine where do I fit in the spectrum of a person who has cancer and a spectrum of needs that they have. It might just be driving somebody to go to the appointment because they can't drive because they have they have surgery up in the armpits, right? It might be cooking a meal one night for the children, inviting them over to have dinner, or they're home alone, cook some soup when they come to the hospital. Do you understand? Mm-hmm. Helping them with their laundry, going and talk to them, praying with them, reading with them, going for a walk with them. So I think every person has to determine what is my position. So while I'm screening myself, I'm also making sure that I offer. My experience is not having cancer, but you have that experience. And you probably can tell me what I need to do, right? But the person who has cancer also requires the support of people who are supposedly normal, right? So I think our faith-based organizations, where a lot of our women, and principally women, go to faith-based church, right? Those are the environments in which we have to be able to speak about this freely and show other women how they can contribute to the wellness and to the well-being of the woman who's already affected by breast cancer.
Right. Let's talk a little bit more about people who live with breast cancer, and probably maybe extend a little bit more on the support system, and also on the support system for people with that, and then we can probably look a bit at the treatments that are available.
Okay, so there are women whose situation is not operable, okay? You can't have surgery because if you have a small lesion that is not spread very far, your surgeon will remove it. Can remove it, cut it off surgically. But there are women who cannot have surgery because of the staging of the cancer is beyond where surgery is possible, safely. These are women who will probably be on chemotherapeutic drugs. And often they start on the chemotherapy. Chemotherapy means chemical therapy, okay?
Right.
Tablet. We take chemotherapy for pressure. It's just that when it's for cancer, it's referred to it. They're oral chemotherapeutics, drugs that you take by mouth. Right? Cancer therapeutics. And there are a lot of it is intravenous, right? So you go to the ward or to the clinic or wherever you go, and you get your infusion, your IV, right? And then you go home every so often, and you get your blood checked and all the rest.
Right.
So for the women who have inoperable lesions, they will be on chemotherapeutics, and sometimes, providing the chemo does cause the lesion, that that lump, to decrease to a point where it can be operable. It can be removed.
Interesting, yeah.
Right?
Okay.
Yes. So that can actually delay, unless it's gone through your blood, to your lymphatic system and spreading. But at least you can remove the lump if you can get it to be decreased, right? To create less chances of bleeding and etc. So those are the women who have challenges and require a whole lot of support. Because these women can't work, okay? Remember, one of the risk factors if you're 45 to 55, right? But that's people working actively at 45 to 55.
Yeah.
If you are an engineer, that's when you're best off. If you're a teacher, that's when you've gained all the experiences. That's when you know how to control a class. If you're a lecturer at the university, you're on top of your game. If you're a housekeeper, you're really a professional by then. So to be taken out of your daily routine creates a lot of challenges. So having support groups does offer a means of survival, right? And for the person who suffers, but also being able to support the family, especially emotionally, because this is difficult, right? Because sometimes there's pain, all right? There's pain. Once you have a lesion on, it's going to be uncomfortable, right? Your social life is hampered, is going to be affected. You don't want to go in a crowd where people hit you up on your breast and make it worse and all the rest of it. So, lifestyle changes for that person, okay, in a very conscious way. Often, people are given their therapy, chemotherapy, and of course, the other option is radiotherapy. Guess what? We don't have radiotherapy here. And most of the islands don't have radiotherapy. Trinidad has radiotherapy. I think Barbados. But that's all. You can go to Martinique if you want. But in the Caribbean, in the Southern Caribbean, it's Trinidad and Barbados. And of course, what is the disadvantage of going away for therapy? Any therapy at all, any intervention, you have to go with somebody, okay? And you have to find somewhere to stay. So you have to, whether it's an apartment, an Airbnb. If you have family, glory be, but you might have family who don't want you there too long, whether on the weekend. So you might have to go find a place to stay. Transportation, food. You understand? All the logistics that you already paying for at home, you have to pay for in another country. Plus the therapy is expensive. So go figure, right? It can be draining. We can talk about solutions after to the disadvantages, okay? Solutions, the challenges that the system has to address in order to make it not so difficult for people who have breast cancer, right? One of the other things that we tend to forget, women who have had their breast removed need to put something in their bra to create some balance. Not all women do it, but they need to get prosthesis and get bras that fit properly, that helps them to use their prosthesis. So some get bras that have the prosthetic side and the ordinary side and the sizing. Because you still want to regain your self-esteem. You want to look nice when you go out. When your hair starts growing back from the chemo and stuff, you really want to look nice. You want to be accepted again. And that's what we want, that you can live as normal as possible.
Right. Excellent indeed. So, Doc, well, let's take a short break. When we come back, we're going to delve in some more issues as it relates to that. Living with it, the adjustments that one may have to make so that they can live an almost normal life and for very long. So we take a short break and we'll be right back. Do stay with us, folks.
Distributed by Echo Blue Limited. Visit us on the Lansopine Main Road or call 405-4818.
Asian Spa and Wellness Cafe, nestled in the serene surroundings of Le Bleu, Calivini Bay, St. George, is the perfect spot to unwind and relax after a stressful event or when you wish to spoil yourself in the most comfortable and relaxing atmosphere. They offer many different massage modalities, including thigh hammer, washer and cupping, signature thigh deep tissue massage, also facials to depuff and tighten pores, deep cleanse full body, hair and nail treatments and more. Take a walk down to the cafe for authentic Thai breakfasts and delicious traditional dishes. Choose from our special mixed drinks, both hot and cold. Opens daily. Visit Asian Spa and Wellness Cafe today, Le Bleu, Calivini Bay, St. George, because you will not regret you did. Are you longing to taste authentic, flavorful dishes from Thailand? Then look no further. Konthai, the newest restaurant located at the back of Galleria Mall top floor, is the place to satisfy your taste buds for Thai dishes that are well seasoned with fresh local spices. They offer a great selection of sumptuous dishes that will tantalize your taste buds. Visit Konthai today because the food is good, the ambiance is great, and the staff friendly. Available on Carabites and Yogo Grenada. For more information, call 456-0074 or visit conthaigrenada.com or stop by the new Galleria Mall, Grand Anse St. George. I'll meet you there.
At Oasis Pet and Garden, we bring you the best products at the best prices nationwide. Pet lovers, we have a wide variety of loving, healthy pets just for you. Hamsters, guinea pigs, fishes, birds, puppies, bird food, and dog food. Visit the Oasis Pet and Garden today. Conveniently located along the Wester Hall Main Road, Wester Hall, St. David's,
and Melville Street, St. George's. Now serving you at 2 locations. Visit us today.
Drug abuse. Cancer.
Measles, diabetes, AIDS, cancer.
Welcome back, everyone. It is Tuesday evening, and so, excuse me, it's Doctor and Call. Dr. Sonia Nixon is with me, and we're talking, well, the month of October, as we said earlier, October, that is Breast Cancer Awareness Month from the 1st to the 31st. Breast Cancer Awareness Month. And of course, this is what we're chatting about. Breast cancer, the risk involved, of course, and all of the other things that surrounds that. Importantly, though, someone with breast cancer, this is no longer a death sentence. I'm gone are these days when people felt that if you were diagnosed with cancer, that was your death sentence. No way. Medicine has advanced significantly, and so there's a lot that can be done to help you to live a normal life. Of course, you also have a role to play. One, in ensuring that you do your screening early. So that if there's anything, it can be picked up early and be dealt with there and then. All right, so it's very important. I think it's probably the most important thing here. Ensure that you are screened early, and from time to time visit your doctor, have a chat with your doctor, get information, understand how these things work, what to look for, the symptoms, the signs, all of that. And so just in case you feel something a little different, that you need to move immediately, go to your physician, have a chat, explain to them, what is happening, and so you can deal with it, of course. And folks, Dr. Nix is always available. She's at the Bruce Street Mall on the 2nd floor. You'll find her there. You can go chat with her. And I know many of you, in fact, even last week, someone called to say how simple she makes things, how easy she communicates so that we all understand it in layman terms. So that is very, very important, very, very important, because of course people like myself and those of our listeners, we are not medical people, so we don't understand those medical terms. And of course, Dr. Nixon can really break it down and help us to understand exactly what is it we're talking about. So it's important to do that. Go visit her, do your checks, do your screening, make sure everything is all right, so that you can feel comfortable when you move around without the fear or without wondering whether or not, boy, I wonder this thing of feeling there is serious. And you moving around frightened, but you're not going and check it because you don't want to hear what your doctor going to say. Well, guess what? The only how you can fix it is if you go and you get the information, and together with your physician, you work on it. So, Doc, maybe we could just briefly just mention again, because we've done this before and we will continue to do it because it's important, the signs and symptoms of breast cancer, and then let us look at people who are diagnosed with that, some of the lifestyle changes that can actually help them to live comfortable and longer.
So, like in every other disease, you can have no symptoms, especially in very, very early disease, right? You may have no symptoms whatsoever. But you do have a little something that's growing, that's different, that's going to affect it's abnormal, it affects the tissue around it, so you feel a little discomfort, a little itchy, a little pain. It can be big enough to make your breast look different from the other one. You can have secretions, you can have bleeding, and like I said earlier, you can have an open wound if it's very late in your cancer diagnosis. Because some of us say, it's just a thing. But also, you would feel a lump, and like I said, breast is lumpy tissue. That's why you have to learn to examine your breast to know what is normal, and when there's some stranger. For the most part, the most common breast cancer lesions, the cancer swelling, the thing that occurs in there, the change, it's a little hard. Singular, one lump, one solitary lump, but it's hard. You know what it feel like to me? It feel like a damsel seed. You know, damsel irregular and hard, like a stone. That's why they call it a seed, because it's hard. People go and say, I have a seed in my breast, and it's hard. Okay. And often it tends to pull the tissue around. So you might see the skin on the breast looks like how orange look with the dimples.
Yeah.
Right? Because of all the other inflamed tissue, and this lump sends out pickles and it pulls everything. So when you examine the lump on your breast, it doesn't. If you move it, it moves everything because it's attached so intimately by the fibrous tissue to the other parts of your breast. It may or may not be painful. Sometimes, most times, it's not. It's just there. It's not tender, sorry. So you touch it, it's just hard, but it's not really tender compared to the fact that it exists and the nature of itself, right? What else? That's about it. And sometimes when it starts to extend, yes, you will get pain in the armpits. If it's present to your chest wall, you will get discomfort when you're breathing, wherever. right? But by then you should be able to recognize, oh, I have this thing in my breast. It feels like a big stone. Okay, it's no longer a little jams of seed. It could be a big gravel or like a stone mango with. Okay, so don't be. The first thing we tend to do is be so afraid. In the beginning,
yes,
we get fearful, we get angry, in our environment, people think somebody do them something. Nobody don't do nothing, right? So there's shock and anger and fear and anxiety and, of course, profound sadness. And that's the kind of emotions that people will experience, because you're sad because the things is the end of your life. And like I say, if you have little children, it becomes even more difficult. If you're caring for your older mother, you don't want to die and leave your mother there with no one to care for her, etc. You don't want to lose your husband. You don't want to lose you don't want to lose anybody. You don't want your parents, you don't want your family to be broken by your absence. And even if you live alone, you don't want your friends to have to suffer this. You don't want to have to go through the illness and this. So you're really angry and feel and start to say, why didn't I? Maybe I should have. That's kind of water under the bridge. We just need to go ahead. Right? People can feel lonesome, okay? Especially if all your friends are okay, everybody's still living their lives. You feel isolated. You feel, man, this is really hard on me. And there's nothing wrong with feeling sorry for yourself. You can feel, boy, this is really hard on me. But at the same time, what can I do to make myself better, right? And of course, we talked about the issue of body image. Some people are bold enough, right? But some people are not. And where our men don't accept a woman, where there's been a mastectomy, where the breast has been removed, it becomes an issue. And I've known men who have left their wives or their girlfriends and men who will not date a woman because she has had breast cancer, right? And she's had a mastectomy. And that's sad. Talking to family is important, but family also has to be educated. And that's why I said everybody should learn about how do I cope with breast cancer as a challenge, even if I don't have it. Glory hallelujah if I don't have it, but how do I cope, right? Talking to you have to reach out. And I think the rest of people need to reach out to the person who has breast cancer, because the person who has breast cancer is in such a state of grief on their own, so much confusion and anxiety that they're not able to cope. Survivors are very good people to talk to because they can tell you. Remember, all of us have stories, right? We share our stories and we help people to transition. And of course, like I said, mental health support is very important. But you will have physical problems because we will have to have treatments and we'll have to have treatments to. I'm sorry, I have to move. We have to have treatments and sometimes, most times it's surgical. And in having surgical treatments, our patients, we have pain. Surgery, getting over surgery, it's a painful experience. So, so pain is one of the main things and discomfort, but pain is one of the things we have to deal with after surgery. Mm-hmm. I'm sorry. Right? Pain is one of the things we have to deal with after surgery. Feeling tired, feeling nauseated, fatigued, especially if we've been sick for a long while. We feel nauseated because the chemotherapy can make us feel upset. Or sometimes just the medication we're taking by mouth, the pain medication can make us, we lose appetite, we lose sleep. Those are some of the physical symptoms that we'll have in the post-surgical and as a matter of treatment. We are talking to some people, sometimes when you get chemotherapy, you're so hot. You can't imagine, you can't sit in front of the fan, depends on what agent they're using, okay? Mm-hmm. And of course, it's up to you. And you may not be able to find a comfortable position to lie in your bed because you have had this surgery. So where you could have lied on any bed to sleep, now you need to have enough pillows to prop you up, to keep your arm up and all the rest of it because you've had surgery. When you have extensive surgery, you can actually have a lot of swelling in the arms. If they've gone into the armpits and removed the lymph nodes, there's swelling. sometimes some of the muscle gets lost, and it's just the healing is difficult, plus the reinstatement of your life. Okay, the rehabilitation is difficult. So you need physiotherapy, etc., right? To be able to use whatever muscle is left and stuff. And of course, scarring on your chest, even if your whole breast is not removed, you may have scarring and deformity of the breast. And that's kind of hard to deal with,
Right.
Chemotherapy. There are some women who develop cognitive challenges when they have had chemotherapy. They can't think as well, right? Because they get chemo brain, right? Numbness, tingling in their hands, especially if you have to get ongoing therapy, it becomes difficult for you, right? And like we said, if a younger patient, the long-term physical challenges, you're not able to, if you have early menopause because of your chemotherapy, right? You may have things like reduced bone density because of the thing. So you get fractures easier. You have more pain and joint pains and stuff, right?
Mm-hmm.
What changes in your social life is very important, your social and working life. Remember, we talked earlier about women not being able to work.
Yeah.
You simply can't go to work, or there have to be workplace adjustments for you so that you can go. If you work on a computer and your armpit is swollen, it's going to be difficult. Your boss will probably have to do some ergonomic changes in order to make it comfortable for you, right? It is important that we seek support. We also need to reach out to support groups. I know that Pink Ribbon, for example, go up to the hospital, so they kind of know a lot of the women. They go for when people are getting chemotherapy, they provide a snack for them during the chemotherapy, and they engage, right? It is good to find even one person whom you can establish a buddy relationship with, because that's important. But you also need to maintain a relationship. This is in coping, right? You need to talk to your friends, you need to talk to your pastor, you need to talk to the people who you trust, your family, as to how you feel, because it's difficult, right? And we, like I said, have to learn what people have what people experience, so we can help. And nobody helps you better than somebody who has walked that path. Okay, that's why survivor groups are so important.
Right.
Of course, you're gonna have to take pain medication, nutrition is important, okay, because
Right.
you're really healing from a big place. So the things that you would normally make you unhealthy should not be a part of your diet. The sugar sweetened beverages and the over processed foods and stuff. You want to go to simple, clean, good food, low fat, preferably no sugar, because it is claimed that sugar does potentiate the growth of cancers. Vegetables, water, exercise, fresh air, the things that should have been done before you got sick.
Right.
If you're doing it, you still have to engage so that you can have healing and you don't have one of the things that we don't think about in relation to cancer management is the whole issue of re-engagement in life. Who counsels you as to how you reevaluate your life? That comes in if we had good counseling facilities, right? Or people had access to good counseling during dealing with severe illness. And it may be possible to go back to work. It may be possible to re-enter the workplace, and in doing so, they may need to change your post. You may need to use other skills that you have to keep it up, because you still need to eat and pay your mortgage and pay your rent and all the rest of it. So I think also workplaces, the workplace must make the issue of breast cancer, especially since so many of our workplaces are monopolized almost by female workers. That must be something that is spoken of in health and wellness. Okay? what can happen, what can be the worst thing, so that we can all be a source of support to each other. And above all, we can be tolerant to the changes and the challenges that somebody who has had breast cancer in particular is dealing with. All right? You know, we spoke earlier about the whole identity thing. People don't hide it anymore. I'm a breast cancer survivor. You know, they're not afraid to say that. Right. How can I help you? Here's my story. And that is what the World Health Organization is saying. Yes, you have your own story, but we have to bring our stories together so that we can take care of the other people who have new stories, so that it can know that their story just adds up to the color that the story that we have as a collective, you know, exists.
Right, wonderful. And Doc, finally, we've heard the term remission before. Your cancer has gone into remission. What does that mean? And also, what are the chances of someone, let's say, for example, getting the chemotherapy? Or, well, let's leave out that part of it. But let's say someone having a surgery. Right, so the breast cancer surgery, the breast is removed in totality. What are the chances of that person, the cancer reappearing? So reappearance and remission.
That's a very subjective thing, and it depends on how extensive reappearing. Let's talk about that first, right? Mm-hmm. Reappearing, recurring cancer will depend on what stage your cancer was, how much. So if you have a stage 1 breast cancer, we are hoping that your surgeon will excise all the tissue, sufficient tissue around it, or even do a total mastectomy, right? Where he takes away the total breast. So, and then when they take the tissue to the lab, they look and they see there's no involvement of the lymph nodes, that you have excised all the borders. We'll tell you the borders are clean. Most people still recommend that you have chemo after you've had breast cancer, so that if there are cells that in surgery may have gotten away and inoculated tissue around it, we can take care of those. If you have a cancer on which there's been surgery, but you know that there is not, you haven't taken away everything, there's always a possibility that it could turn up, especially in a distant place, right? If remission is related to being able to remove, having recognized, testing and recognizing that whatever cancerous cells can cause you to have a disease do not currently exist.
Okay.
That's when your cancer goes into remission. You don't see anything. Your bloods are fine. You do a mammogram. You do PET scan, which looks at small, very intimate tissues, whatever you can do, and there's no sign of your disorder. You can say you're in remission. But you still have to keep checking so this thing don't turn up. And remember that if you've had breast in the right breast, if you have cancer in the right breast, it can also turn up in the left breast, or it can turn up in a different part of the original breast that has been affected. Okay? Whatever was your predisposing factor may have been genetics, it can turn up again. All right? So that's what it is about. So I want to talk a little about policy, and because I think we should always speak about policy, because you can look across the socio-ecological environment. Me, my household, my workplace, the community in which I live. But then there's a bigger thing, which is the government that makes decisions. So I can do everything I want to prevent cancer. I still may. It is important that and even especially for children. Obesity. I keep forgetting that one. Obesity is one of the predisposing factors. Overweight women are at a greater risk of developing breast cancer. So this is where policy comes in. Do we have the right foods? Are we educating our population as to what we eat? Is there a place to exercise? Are women unnecessarily placed under stress? Right? Because there's some things that you can't change. And you can't change the fact that you're a woman and your mother has had cancer, and you understand?
Right.
But there are things that you have control over. You have control over if you're going to drink, if you're going to smoke, how you're going to eat, whether you're going to maintain your size. Those are the factors that you have control over. And we have to work with those factors. Okay? We as a government, the people who run the health system, have to ensure that people have adequate nutrition accessible, that you can live with it, that our lifestyles are healthy, that we understand our lifestyle must be healthy by the education, the health education that is shared with the community, right? By making sure that we have place for children and adults to exercise. You're not supposed to cost us, so putting up sidewalks so people can go walking, safe roads, taking off some of them crazy drivers off the road who try to kill everybody they meet, but making sure that there's space to walk, making sure there are playgrounds in communities, that when we're building homes, when we're building housing solutions, right, whether it's multi-story houses or single houses, that there is a place where the community can exercise. That's part of policy, right? And that's correct to do as far as the built environment is concerned, right? And that you encourage people who live who work in high-rise buildings to walk up to the 3rd floor if they have to. It might be a little harder going to 4th floor, but make sure that they can walk up, right? And do the things that make consumption of bad food not attractive.
Right.
Front of package one labeling, taxation, so really a lot of education on smoking, a lot of education on alcohol consumption, especially our young population. We see our young population very, very hooked, and a very young population on using vapes. Okay? They're going to transition to tobacco use, no doubt about it, eventually. As you get older, you try something new, right? And tobacco is even if you use a vape that has nicotine only, they will smoke. And the smoking tobacco is full of toxins. And like we said it every time, tobacco is going to kill 50% of the people who engage with it. Whatever cancer, most cancers have tobacco as a predisposing, as a risk factor for developing cancer. So the policies that make us control all the negative things must exist.
Right.
Okay? But also we have to provide facilities for screening, right? Whether you have a home, you have community medical centers where you can go and hear information and be examined by the nurse, have a mammogram, have access to having a mammogram, have access to having even an ultrasound, which is, like I tell you, by the trained hands, is very good, right? Whatever. We might need an MRI, depending on how complicated it is, right? We must ensure that the facilities for diagnosing correctly are there. Okay? We must make sure that we don't miss anything. Right? And there are going to be some things that we're going to miss. Right? We don't have genetic testing, but we can facilitate people who want to do it, send it overseas and get their genetic testing to see what the risks are. And we can encourage all of that through education.
Right.
We must also make sure that we have facilities for surgery. We have the appropriately trained human resources, right, to do appropriate surgery, to recognize. And we must be culturally appropriate, and we must also be emotionally appropriate, those of us who offer care, right? We must be compassionate, we must be understanding, and we must be ethical in our practice. We must want to ensure that the people who we're caring for are actually getting what they need, right? And of course, the other therapies, the chemotherapy and the radiotherapy and the emotional therapy and the support systems. And of course, there are women who are going to not survive, The women, we don't have hospice services. And we have to have pain management for women who, are very ill and they have severe pain. So there are a lot of things that has to be done. What's interesting is that there's no island in the Caribbean who has a cancer policy. There are some issues. So like here, we have things that prevent cancer. So we have a school nutrition policy, right? We have a childhood obesity policy. And we have primary care. We have AMA ATA that we implemented in the primary care system, right? But we don't have a big whole policy that takes into consideration ensuring that all of these other things, all of these necessary phenomena are included to ensure that we have a decreased, right, incidence as far as we can, and where it occurs, that is diagnosed early and people are appropriately treated so that the incidence of death from cancer is decreased more and more and more.
Right. Okay. Lovely. So, Doc, we're out of time. So 30 seconds just to sort of highlight the importance of Cancer Awareness Month, and we'll wrap for this evening.
So I want to tell everyone that the walk's going around, but make sure when you go to a walk, the pink shirts are pretty. This is from Sado. The pink shirts are really pretty. I think Sado's walk was on the 1st of November because there's a holiday next weekend when the walk was planned for. Mm-hmm. But I know there's a walk on the airport on the weekend, early in the morning. I think that's the best walk. I think walking early in the morning is nice, and sometimes it rains. But there's an airport walk, and it's been advertised, so look on social media. Participate, but participate not just for yourself, but that so you can support people who have already been affected by breast cancer. But participate also so that you can get more information, you can show compassion, and you can see how you can help somebody who is living through this, right? And you can learn from their story. Yes. While you don't really have a story. It's important. I think one of the hotels is having a walk as well. Pink Ribbon is having a walk. There's a walk in Guelph. All of this is in the news. So please join. Okay, raise the conversation in church. We gotta talk about it so it becomes as easy as talking about jab. Okay, it must be something on our tongue. It is still the number one cause of cancer death, and we're gonna have to remove that. Number one cause of cancer death among our women. Secondly, I want us to remember that men also can have breast cancer. So men, you too need to check your breast every so often. If you find a little seed in there, go see the doctor, because early diagnosis is also very important for survival. Okay? And you're going to have surgery just like the female and all the rest of it. So remember. And I'm going to ask our men, since it is said that, it is not said, the truth is that most women's lumps are discovered by their partners. So maybe our men should learn how to examine breasts in a very scientific way, so it's easier, okay? But most women breast lumps are discovered by their partners. So men still know how important your role is in helping your partner to diagnose early so that we don't have to deal with death.
Right, wonderful. At
the end of the day, everybody's kind of responsible for themselves and getting support from others. So I'm going to ask all women, we say 45 to 55, but I think everybody, especially if you have primary relatives, your auntie, your father, sister, them, your mother, sister, them, that you should actually get yourself checked. Okay? And to do it often. Ask your doctor, ask your nurse, ask somebody to teach you above all, because I find that's the most empowering way that women are not afraid to examine themselves. It is real. We don't have a lot of money. We don't have a lot of resources in our healthcare system to deal with severe illness. And I don't think any woman deserves to die from breast cancer, because it can be extremely devastating, painful, isolating from your family. And like I said, we don't have hospice. We don't have hospice where you go to in a place, where you go and people are trained to take care of you or to take care of us at the end of our life. We don't have that, right? Families who are dealing with it, seek out help. the Cancer Society really is responsible for training, for education and screening, but you probably can get some information from the Cancer Society and the other agencies, the other support groups do have a lot of information that they can share, right? And ask your doctor. If you're worried, ask somebody who you think should know better than you, all right? But everybody's experience is their own, but we're going to pool our experiences to make sure that we can attenuate the level of death from breast cancer, because we can do that. Okay.
Yes. We can.
I want to remind people one thing. There's been lots of water shortages, so I'm going to ask people, remember to boil your water. There is severe respiratory tract infections going around, so please look out. If you get stuffy and all the rest of it, please go to your doctor early. I don't know about the dengue. I sent a patient to check for dengue and it was negative, but still, some of the things are still hanging around. Make sure we boil our water properly for children to drink, because that's a big challenge.
Okay. Well, thank you very much, Doc. It was a pleasure as always. And to our listeners and viewers, we thank you for staying with us. We hope that in one way or the other, do get involved. Yes, because we all have our part to play. Thank you and do have a good night. Join us tomorrow evening, 8:30 for Kaiso Talk. See you then.